Hello, and thank you for allowing us to participate in the 10th annual healthcare case competition hosted at Johns Hopkins. Our group consists of myself, Michael Manna, Jessica Hanway, and Shumi Shaw, Noah Benjamin Pollock, and Samson Lewis. And today we're going to be talking about the role of telehealth in the pediatrics market. So with that introduction, let's dive in. One of the major problems that hospitals are currently facing is a gradual rise in inpatient costs. As we see on the graph here, we've seen that the average price of inpatient admissions has increased steadily from 2014 to 2018, and this is across all categories within hospitals, including surgery, newborn delivery, mental health, and substance abuse. United Health Group found that hospital prices for inpatient services increased by 19% from 2013 to 2017. This 19% growth in inpatient costs has outpaced that of physician prices. Inpatient stays have also declined about 6.5% over the past decade, despite population growth and a shift in demographics. We also see that there's difficulty accessing care, especially during times like these, during a pandemic. And we also see that pediatrics are an underserved market for telehealth services, yet there's a substantial need for it. New parents are in need of doctor consultation for newborn babies and toddlers, and they need it quickly. And that brings us to another trend that we have seen, which is a gradual transition to outpatient services. We've seen that the growth in hospital revenue from outpatient services has almost doubled over the last couple of decades, and this is because doctors are able to perform many of the surgeries and procedures that they used to do within their hospitals safely now in an outpatient setting. We present the solution that hospitals should refocus their current model to capture this growing transition to outpatient care, and we believe this should be done through a subscription telehealth service focusing on the pediatrics market. The pediatrics market represents one of the largest opportunities for hospitals to take advantage of telehealth services within this space. Some of the metrics that we have is that there were approximately 171 million visits to physicians' offices made by children under the age of 18. There was an average of almost 4 million babies born between the years of 2018 and 2020, and the average visits for parents and their newborn babies within the first year of that child's life was 8 visits per year. The pediatrics market also has a monopoly on in-person visits, with this group of people having more visits relative to every other age group out there. And this also helps and goes hand in hand with telehealth trends that have been occurring as pediatric visits have declined during the pandemic. Certain pediatric visits could be handled over the video calls, and it's also more convenient for parents, and this makes parents and children more comfortable with video communications. And we've seen with the pandemic happening that hospital systems are already scaling their telehealth systems. The Center for Medicare and Medicaid Services has also found with the COVID pandemic that there's been a 44% decline in child screen services and outpatient mental health services. And we see that now's the time for pediatricians to join the rapid adoption of telehealth services. 6.5% of health claims in December 2020 were for telehealth services in comparison to just 0.2% of claims in December of the prior year. And these trends in declining visits in pediatrics hold true even in 2021. Pediatric visits in March of 2021 were down 24% compared to the prior year. And with that said, I will hand it over now to my teammate, Samson Lewis.
Thanks, Mike. So we've addressed the problem for hospital systems with a specific focus on the largest inpatient market, infant care. There is an urgent need for telehealth expansion to service pediatric needs. But the next question is, what would that look like? Thanks to an established and continuously improving telehealth infrastructure from specialized firms and hospital systems, the shift to telehealth for parents and their infants should be quick and easy. We've shared a basic flowchart of this process. The parent and the child schedule and join their video call, where they immediately reiterate their needs. Some triaging has already occurred pre-call when the patient describes the problem and can help minimize the calls that do in fact require an in-person visit. Once the problem is clarified, treatment, feeding advice, prescriptions, and diagnosis of common colds, teething, or other minor ailments can be handled. If necessary, an in-person meeting can then be scheduled, but otherwise the practitioner can answer questions on call and leave the patient with peace of mind from the comfort of their own home. The idea sounds great, but how do we execute and implement, and what will it cost? At this point, hospitals should be considering telehealth or already employing it, and either creating or furthering that partnership is the first necessary step. From there, the video conferencing infrastructure and team training can be handled jointly between the hospital system and the telehealth provider, as training is a key piece of their value proposition. With regards to pricing, we recommend providing both pay-per-visit and monthly pay models to meet the needs of the greatest range of new parents. Fortunately, there are numerous go-to-market options to facilitate this decision and the launch in general. Hospitals with existing telehealth infrastructures and systems, which many of the best do have, are best positioned for this growth into telepediatrics. However, specialists and major telehealth players have emerged that can help get the ball rolling if needed. Overall, pediatric telehealth will reduce inpatient costs to hospitals while increasing access and equity in the pediatric space long term. With our pay models on a per-visit basis for those not necessarily covered by insurance, we can connect parents to care even if they don't have health insurance. Additionally, the ability to host calls from home benefits single-parent families, working parents, the disabled, those with limited access to transportation, and those that require multilingual healthcare providers. All these equity challenges can be addressed and facilitated by virtual care, all while building lasting relationships with parents and their children from the earliest possible age. We believe the telehealth trend is here to stay, but the focus must shift to pediatrics and infant care. They visit the doctor more than any other group, are a consistent and large market, and face challenging healthcare inequities that can be addressed by telehealth. For these reasons, we recommend prioritizing this shift and investing in pediatric telehealth now. Thank you.